Hey there! Did you know that prostate cancer is one of the most common cancers affecting men? In this video, we will answer the top questions people ask about it. If you or someone close to you has concerns, this video is for you. Let's get into it. Alright, let's start with question number 1. What is prostate cancer? So, prostate cancer is a type of cancer that develops in the prostate gland, a small, walnut-sized gland in men that produces seminal fluid. Prostate cancer typically begins when cells in the prostate start to grow uncontrollably. Some types grow slowly and might not cause serious problems, but others can be aggressive and need to be treated quickly. It's important to know what you're dealing with, so let's keep going. Now, question number 2. What are the early signs and symptoms of prostate cancer? This is tricky because early-stage prostate cancer might not show any signs at all, but when symptoms do show up, they can look like trouble urinating, a weak urine stream, blood in your urine or semen, or pain in your lower back or pelvis. These can be signs of other conditions too, so if you notice anything unusual, it's time to check in with your doctor. Question number 3. What are the risk factors for developing prostate cancer? Great question. If you have a family history, like a dad or brother who's had it, your risk doubles. Other risk factors include genetics, old age, and if you're of African descent, you're at a higher risk. Lifestyle plays a role too. Your diet, activity level, and smoking can make a difference. On to question number 4. How is prostate cancer diagnosed? Usually, diagnosis starts with a PSA blood test to check your prostate-specific antigen levels. If your PSA is elevated, your doctor might suggest a biopsy to confirm whether it's cancer. Question number 5. At what age should I start getting screened for prostate cancer? If you're at average risk, you should start talking about screening with your doctor around age 50. But if you're at higher risk, let's say you have a family history or are of African descent, you might want to start closer to age 40 or 45. It's all about finding the plan that's right for you. All right, question number 6. Is prostate cancer curable? Yes, absolutely. When caught early, prostate cancer can be treated very effectively. But if it spreads to other parts of the body, the survival rate drops, which is why early detection is important. Question number 7. What are the treatment options? It depends on the stage. For a detailed look at the treatment, be sure to check out my video on treatments, where I break down all the options including surgery, radiation, and advanced treatment. You can find the link here in the description below. Question number 8. How can I reduce my risk of prostate cancer? Great question. While nothing is 100% guaranteed, you can lower your risk by adopting a balanced diet filled with veggies, fruits, and whole grains. Regular exercise, staying at a healthy weight, and quitting smoking also help. These lifestyle changes don't just help your prostate, they're good for your whole body. Let's move to question number 9. Are there foods or habits that increase the risk? Yes, unfortunately. Diets high in red and processed meats and foods heavy in saturated fats can up your risk. Smoking and heavy alcohol consumption are also risky. Now, question number 10. What should I ask my doctor if I'm diagnosed? This can be overwhelming, so go in prepared. Ask about the stage of your cancer, what treatment options are available, potential side effects, and what to expect in terms of quality of life. The more you know, the more confident you'll feel about your choices. Question number 11. Does having an enlarged prostate mean I have cancer? Nope, not necessarily. An enlarged prostate, known as BPH, is common as men get older and is usually not cancer. But since symptoms can be similar, it's important to get evaluated to make sure. Finally, question number 12. Can prostate cancer be prevented? While there's no foolproof way to prevent it, you can definitely lower your risk. Healthy eating, regular exercise, maintaining a healthy weight, and not smoking all help. And of course, don't skip your regular screenings. Catching it early makes all the difference. And that's a wrap on the top 12 questions about prostate cancer. I hope this brought some clarity and valuable information. If you found it helpful, don't forget to hit that like button, share this video with friends and family to spread awareness, and subscribe for more health tips. See you next time.